So, welcome, Deb. So, this is Deb Thule. Deb is with the Well on Your Way program, and the Well on Your Way program works with youth and young adults as they transition from the pediatric to the adult healthcare system. So, Deb, could you tell us a little bit about your program?
Yeah, happy to. Thanks, Gina. Really, the purpose of the Well on Your Way program is, as you've said, to help youth and young adults transition from pediatric to adult healthcare. But primarily, my role is to work with clinics to help them prepare their patients and families for the transition to adult healthcare. We have my role is part-time. We also have a full-time navigator, and the full-time navigator is a part of a research trial, and her role is to actually work with them kind of at that point of transfer to help them as they leave pediatric care, kind of walk across the bridge to adult care and, adapt and adjust to that program. So in my role as coordinator, I work closely with the clinics to help them develop individualized discipline-specific transition services for their patients. And over the years, I've been in this role for several years now. Over the years, we've developed a generic, we call it a transition toolkit, which has several resources and tools in it that can be modified by each clinic to address their specific needs. That way, the clinics can just take the tools, we tweak them, and they make them a part of their program. The tools and resources are really designed to build capacity of healthcare providers, of patients, of their families, to help assess transition readiness, to document and keep track of patient and family's progress, related to transition, to summarize the medical information in a way that is robust so that the new adult healthcare providers are kind of caught up to speed. So it's really helped build capacity of them as well. And then provide information for patients and families about resources that are available in the community, resources that are available through Alberta Health Services, and the differences between pediatric and adult healthcare. So there are our tools and resources were developed mostly here, although we have borrowed stuff from Sick Kids and the BC On Track program, got transition in the States. Some of the tools and resources that we have are websites, brochures. We have magnets that the clinics can hand out. We have transition guidelines, transition readiness checklists. We offer a teen and parents talk transition workshop. So there's introductory letters introducing transition, transfer of care letters that clinics can hand to patients and families when they leave, outlining where their care is being transferred and how the clinic that they're going to is going to look a little different, like what those actual differences are between their pediatric program here and the adult program that we're referring them to. So that's kind of the basics of my role. In addition to that, I work with those, I consult on cases where transition is a little more complex and it's not easily transferred to the adult healthcare system. And I provide kind of a case-by-case basis consult service whereby, I work with pediatric teams to help them find the resources that their patients and families are going to need. A help with attachment to adult acute care, with attachment to primary care, those kinds of things. So just to ensure a smooth transfer of care for those who are more complex.
Fantastic. So thinking back to development of the program, can you tell us a little bit about what the identified need was that kind of prompted thinking about transition services in a different way?
Okay. So April 2006 was actually when the first adolescent transition coordinator was hired here at Alberta Children's Hospital. So this position has been in existence for a long time. The role has kind of changed over the years because at that point in time, the mandate was really to look at what was going on here and come up and implement an adolescent transition action plan. It was to kind of engage staff in developing a site-wide service, because what was happening at that point was that services were fragmented, they were inconsistent. It was really ad hoc. Clinics did a range of things. Some were, in the process of developing stuff. Some were had, a transition service that they thought was really good. Others, it wasn't even on their radar. So clinics here were at varying points, and it was really when transition was becoming kind of a bit of a buzzword, and everybody was starting to think, oh, we got to address the needs of these patients. So really the position was initially hired to kind of do a bit of a needs assessment, what's going on out there, what's happening across the country, what are best practices in adolescent transition, and then to come up with okay, so how are we going to, implement something here that's wide that everybody can engage in. And so the first few years were really just kind of working with stakeholders, people who were keen and interested, pediatric providers, adult providers, community providers, to try and figure out what was needed, and how to move forward. So yeah, it was really to ensure that there was something happening here site-wide, and that there was a minimum standard of transition that every clinic was doing.
Great, thank you. The next question is a little bit about how the program is structured or funded. So can you tell us a little bit about the funding model for the program and or how it's evolved over time?
The funding, it started with a full-time adolescent transition coordinator that was funded out of operational dollars. Over time, that the adolescent transition coordinator, so my role has gone from kind of full-time to part-time, so it's like 3 days a week, and still funded out of operational dollars. We currently, as I said, have a full-time navigator. That position is funded out of foundation dollars. It is a research position, and our hope is that someday that too will be funded out of operational dollars, that we're going to be able to demonstrate cost savings if we have a service that helps patients actually walk across that bridge, because we can do lots of preparation work, but the adult world is very, very different. And sometimes patients and families need help navigating it when they get there. So the hope is that we can show that, cost savings in terms of emergency visits, in terms of attachment to adult healthcare, in terms of acute care admissions by having a navigator. So the trial is a randomized control trial. It's province-wide, and they're hoping to recruit 600 patients. 300 will get the navigator and 300 will get usual care. And so they're looking at comparing and contrasting from a quantitative perspective as well as a qualitative perspective. They're going to introduce some of the patients and families who got the navigator and some who didn't, to kind of see the different experience. So not just cost. Cost is a big one for healthcare. So we have to demonstrate that there is a need and there's cost savings. So yeah, we're partly
experience as well, which is important. Yeah.
What was that? Sorry.
Experience, measuring experience as well, which is very important.
Absolutely.
So the next question's around, if I were to come to you and tell you that I'm interested in starting something similar in my area, what's some of the advice that you would give me about what's worked well, and even more specifically, what are some of the barriers that you've faced or that your program's been able to overcome that could be a learning for other areas?
So I think I would start with saying, don't start by developing a whole bunch of your own tools and resources. There are lots of tools and resources out there. Sick Kids has tools and resources. We have tools and resources. BC On Track has tools and resources. Got Transition, which is a healthcare research, healthcare transition quality improvement organization in the States. They have resources, and everybody is keen and willing to share what they've done. So it really is a matter of taking what's already developed and maybe tweaking it to your content or your situation rather than developing your own. There's also condition-specific resources. So I think CF has some, cardiology has an iHeartChange website. So there's some, really good, even condition-specific resources out there. So don't start from scratch like we did, because there's lots of stuff out there now, and people like myself who are passionate about this work are really keen to share the tools and resources and get the word out. So so start with something that's been developed and tweak it. The other thing that I would suggest is what we did is we did that needs assessment, then we started to develop generic transition toolkits. Then we worked with every clinic and kind of took this toolkit, this binder of resources, and met with transition champions and kind of rolled it out site-wide. I would not recommend doing it that way. It was way too big an undertaking, and to do everybody all at once was very hard. To maintain engagement because I wasn't always available or they weren't always available. So what I would suggest is start, if you're looking at something site-wide, like we were, start with 1 or 2 clinics that are keen and passionate about improving transition initiatives or starting a transition initiative in their program. Work with them, do some research to kind of get a baseline sense of what's currently happening in that clinic. As you said, Gina, that experience piece, talk to patients and families, find out what's happening, then implement your program. So then you've got kind of even for research, you've got a baseline that says, this is what it was like before we implemented, this is what we did, and then you can do the research afterwards and gather data afterwards to get a sense from those who had access to the transition service, what it was like for them. So I would say, start with 1 or 2 that are keen and passionate, and then
champions.
roll out from there. Yeah. But yeah, what I find is that healthcare providers talk to each other. And so when they see that, oh, this clinic, look at what they're doing, then they phone you and go, I'd like to kind of, can you come and work with our clinic? And so it's much easier to get engagement that way. And yeah, the work becomes much more manageable. And then you can actually measure the difference that you made.
That's great. The next one's around embracing different populations. And so, I think for some programs, what we would be asking is, how would you expand to different populations or to different age groups? This is a, kind of a specific time in life for youth and for young adults. But I guess my question then, or the way that I would ask it for you is, did you start with a specific group or a specific population of youth and young adults, and how did you know when it was time to expand? And I guess specifically for for this conference, were kids with complex medical always part of the program, and or how did you have to shift to be able to incorporate them to better meet their needs?
Oh, wow. Oh, okay.
Question, sorry.
Yeah, so really kids with complex needs, when I first started, there was a successful transitions coordinator that was hired as part of Alberta Health Services. And she was kind of working with people in the community to address some of those complex transitions. So there was other people from Alberta Health Services, there was adult home care was engaged. Here we have something called Persons with Developmental Disabilities, which provides funding for adults to hire staff for community access, respite, supported education, supported employment. And then there's AISH, and Office of the Public Guardian. So there was lots of community providers that were involved. There were, the people from PDD, there were people from adult home care, there were this successful transition coordinator, there were people from mental health. And so they kind of were all looking, the purpose of the role was to really look at what was happening for transition for some of those complex situations and where were the gaps. We found that probably the biggest gap was for people who didn't qualify for supports through Persons with Developmental Disabilities because their IQ was too high, and then they didn't have access to that staffing support that they needed moving into the adult world. And so we're still working out that kink because that's legislation. So but there are lots of services in mental health that are starting to kind of come on board, and that recognition that we need that care coordination for those with complex needs. And, we're going to need some sort of staffing supports and that kind of thing. So um, the complex, yes, they were on the radar, but I think things definitely improved
Mhm.
in terms of the recognizing where the gaps are and how we can address them. There still are gaps, and there are still things that we obviously need to address when it comes to complex care. But I think in terms of like expanding any program, like this program reaching different populations, I think that it's always better. Like I said, kind of in the answer to the previous question, start small, start with one or two, and then expand out. But there are always other initiatives that you can, and things that you can be developing. So we developed a binder of tools to start with. In the last few years, we've developed a provincial transition website. So the Well on Your Way program started here at Alberta Children's Hospital, but really the website is now provincial in nature. So the Well on Your Way program has expanded via the website across the province. Um, I'm currently working with a group of teen and young adult advisors on a social media blitz to try and put information out there about transition so that patients and their families are not dependent on healthcare providers to give them all the information about transition. Because if they come in and it's an acute care appointment and the healthcare team is busy with other things, sometimes transition can get lost at that clinic visit. And so we want to get information out there so that youth and families are driving this initiative. And so we're currently doing a social media thing. So there's always ways to expand and reach more people and get the word out. And really, I figure you just keep doing that until expanding, developing, growing, until everybody has the information. And when patients come in at 12, they're already aware that, at 18, I'm going to need to leave pediatric and adult healthcare. Start to ask questions, start to do some research. Families start to work with their children younger to help them develop the skills that they're going to need to be able to navigate that more autonomous adult healthcare system. So yeah, I just, there's lots of work in this field. It's an exciting area to be in because it really in 2006, it was relatively new. And we've made progress and gains, but we definitely, can continue to do that. And
Yeah.
complex transitions is one of them because there are gaps, system gaps that we need to address.
Right. That's a great answer. Thank you. The next question kind of reflects our current world and our current reality. So how has COVID-19 changed the way that you practice or the way that your program operates?
Okay, so the biggest change since the start of the pandemic is that services and programs are now delivered virtually, which actually I think has been a good thing because patients and families can now, who live outside of the city of Calgary, can now attend things like our Teen Talk Transition Workshop. We actually, the last workshop we ran, we had, patients and families from Lethbridge, Medicine Hat, Red Deer, Airdrie. Airdrie's not that far. I guess they could have driven. But this time we actually have the patient and family centered care coordinator from Stollery coming because they're looking at starting a workshop for patients and families in Northern Edmonton. And, so doing things virtually means we can reach more people, which is great. I'm an in-person kind of person. I would way rather be doing the workshops face-to-face than in person. I would not have even thought to offer the workshops virtually or online because that's kind of not my personality and not how I think. But the feedback that we got, we were partway through a workshop. We were 2 workshops into kind of a 3 workshop series when the pandemic hit. And so in order to finish, we actually had to go online. And it was really interesting to survey the patients and the families, the youth and young adults and their parents who came. Some really, really, really liked the online option. And so it was good learning for me that we need to offer it online because it meets the needs of some people. It might not meet my needs, but it meets their needs. And so we won't go back to doing transition workshops just in person. We will offer them in person because there are those whose needs it meets, but we will also offer an online option. I really do see COVID in many ways as an enabler of transition because virtual appointments weren't on anybody's radar. And now healthcare providers are doing lots of virtual appointments. I think transition is an appointment that in many situations is easy to do by a virtual appointment. And so healthcare providers don't need to just fit transition in to kind of an acute care appointment where they're focusing on the patient's health and the physical health and doing all the testing and that kind of stuff. They can actually do a short virtual appointment with them. Patients and families don't have to make another trip here for a transition appointment to talk about transition. They can do it from the comfort of their home. And we could, that way, it can be a more focused appointment where patients and families can ask all the questions that they have about transition. Healthcare providers can give them that information. And so I don't like COVID. I really want COVID to end, but it has been something that I think is going to enable transition initiatives to move forward.
That's a great answer. And have you noticed a difference in how people request service, I guess? Has the pandemic changed the way in which people have engaged with your service?
Yes, because a lot of my work, like I say, is with clinics to help them improve their transition processes. Right now, clinics here are overwhelmed with like the COVID, the constant change with COVID, right? So there's really not a lot of clinics phoning me and going, come, we want to do a quality improvement initiative related to transition. And rightfully so. They're busy, focusing on trying to learn virtual appointments and get all of that stuff set up. So they're doing lots of quality improvement stuff in other areas that I think will be, like I said, an enabler of transition going forward. But for right now, I'm not doing a lot of that clinic work. However, my workload hasn't changed because transitions have become more complex. It's been because of the risk of experiencing a gap in care when you leave pediatric and adult health care. And because of some of the mental health struggles that teens and young adults are having during this time, I'm getting a lot more contacts and a lot more calls from clinics to consult on those complex cases, those cases where they're really concerned about moving a teen over to the adult healthcare system. So it's meaning we're looking at doing a lot more overage requests here at Alberta Children's Hospital so that we can keep them here for a little bit longer to ensure greater stability. We've found that it is really hard for many of them to attach to an adult provider if their appointments are just going to be on the phone. Right. So it sometimes is better for them to stay here until they can get an in-person appointment.
To build relationships,
yeah. So the work has shifted during COVID, and like I say, doing less of that quality improvement and more of that consult around the complex care needs and addressing individualized transition plans more with clinics.
The next question is a little more around patient and family-centered care. And so I'm curious how youth and young adults and parents were engaged in development of the program and whether they were engaged early in development or how their feedback is incorporated in modifying and improving the program.
That's an excellent question. And actually, when I look back, I have to say that in the early days, there were, a few patient and family advisors that were a part of the early stakeholder group, but it certainly was not a robust involvement back in 2006. I would say that we needed to do a better job of engaging because the needs related to transition is so diverse, right? You have your patients who are like we've talked about the really complex patients who are involved with multiple clinics, have developmental delays, physical disabilities. And then you have those who have a chronic health condition that are going to have capacity to manage it in the adult system and are just going to need to learn how to take care of themselves. So we have everything in between. And we have those who struggle with concordance to medical treatment plans because they're teenagers and they don't want to have their condition. And so, and then of course, the nature of adolescence is an interesting population to work with. So the needs of the population are very diverse. And so having one or two stakeholders, certainly I don't think engaged in the early days was, we needed to be more robust. However, over the years, we, like I said, our tools and our resources have changed a lot since kind of back in the early days when we rolled out a binder to all the clinics back in 2010. And so since that time, we developed here at the Children's Hospital a Transition Advisory Council that consists of youth and young adults with experience, as well as families with experience of transition. And so all of the newer tools that are being rolled out have been developed by them. So the Teen and Parent Talk Transition Workshop that I've talked about on a few occasions was completely developed by them. I worked with a group of youth advisors to create the content for that. And they peer facilitate it, like it's 100% peer facilitated. So, and the parent workshop is the same. I attend the parent workshop and participate and lead the parent workshop, but I facilitate it with another parent. So our guidelines, those were kind of really developed from scratch. We went to our Transition Advisory Council and said, what do we need to do in this time and when do we need to do it? And so they created a roadmap and guideline documents. They were robustly involved in the development of the website. We had a youth on the content development team as we were developing the content for that. So we've come a long way since 2006. And I would say the tools and resources that are part of the Well on Your Way program now are very patient and family centered and have not just gotten their feedback, but have actually been developed by them.
Great, thank you. So we've touched on this a little bit, but I'm curious, as a more, kind of concentrated answer, what is done to evaluate the effectiveness of the program, and is there kind of a formal quantitative and or qualitative evaluation process to see how the program's working?
So there was in the early days when it was initially rolled out. It was rolled out to, I believe, 5 to 8 clinics. And patients and families were engaged from those 5 to 8 clinics. The clinics used the tools and resources. And so there were then pre-interviews and then post-interviews. So there was an evaluation done in the early days around that. I'm going to suggest that we're not doing a lot of that now unless we're going into the clinics individually and the focus is on and doing a quality improvement initiative. But yeah, I do. The way to start is kind of do those pre-interviews with people who, haven't experienced any transition program and are moving into the adult healthcare system, implement a program, and then survey and get feedback from those who've gone through it. Got Transition, which is, as I said, a Center for Healthcare Transition Improvement in the US. They have developed several different measurement approaches. And so you can measure and assess your individual clinic and how well your clinic has implemented the 6 core elements of transition. And then you can measure before, you can measure after, and then you can assess kind of partway through development. They have surveys for healthcare providers, surveys for patients, surveys for families. So there's lots of tools and resources out there related to research if you're developing a program. But I do suggest, start with that group that is hasn't had access, and get their feedback. And I use a measurement tool, getting kind of how ready they are, implement your program, use the same measurement tool afterwards, and as well as do qualitative interviews to kind of get a sense of what patients and families feel in terms of preparation and readiness to move to adult health.
Great. I'm going to ask one more kind of specific question just because I happen to know this one. But using stories, I know that there was a digital storytelling workshop that was done with some of the youth from transitions, and did you find that a useful way to impact or to be able to share successes of the program?
Yes, I think it was a really good way for youth to stop and think about, for themselves, what worked with transition, what was good, what wasn't, what would they recommend, and to stop and reflect on their transition experience, because we don't often do that, right? We just keep
Mhm.
going day to day. And so I think it was a really good experience for the youth, and the parents who created digital stories. But I have found them really beneficial because, when I have a young adult or a teen who's struggling with something, I can often point them to a digital story and go, this person has been there. You've got to see the story. And when they watch the story, it's like, I'm not alone. And
Yeah.
I think that's the biggest thing for the, and the value of stories, right? Is that it provides that context for those who are going through it, who are feeling isolated, who are feeling frightened and scared, or parents who are frightened and scared. It's like, I'm not alone. Other people have done this. And yeah, that encourages and gives them hope in a time that can sometimes feel not very hopeful.
Yeah. Great. Thank you. I'm going to pause for 1 second to just to do a little bit of an interlude. So this next question is again around complex medical. So kind of what the different considerations, I guess, are. So I know we've already kind of talked about that. So I thought maybe I would ask you, and then Carrie, if it's not much different information than when we talked about it earlier in the interview, then we could just cut this question out. So I'll pause again before I ask the question, just so there's kind of a natural spot, and then I'll ask. So does Well on Your Way provide resources for families of children with medical complexity? And are there different considerations or programs, or ways, I guess, that population would engage with Well on Your Way?
Well, the way that they would engage with Well on Your Way is through that consult service, because children with medical complexity have very diverse needs. It's really hard to create a generic package for them because their needs are also different. And so the way I work with healthcare providers who are caring for children with medical complexity during transition is we meet, we talk about the patient, we talk about their needs. And really, I think the biggest key for patients with medical complexity is ensuring that the care coordination that they've received here, that there's someone over on that adult side who can provide that same sort of service, someone who can help them navigate, someone who can break down the silos in the adult healthcare system, ensure that all the providers that are engaged with that patient family are talking, ensure that streamlined, clear communication, seamless communication between providers, community providers, healthcare providers, all of that kind of stuff. So, and that's one of the things that the Well on Your Way program would work with healthcare providers here who are preparing patients with complex medical conditions to transfer, would be to try and find that care coordinator on the outside and who that person is, because it's not always easy to identify. And so
Right.
it's trying to find that person and then get them engaged early on so that the care coordinator here or case manager here or whoever is working with the care coordinator there. And so it's relatively seamless for the family. So they have a relationship that they've started to build. And are, instead of picking up a phone and phoning the nurse practitioner here or whoever here that they're social worker, whoever that they would be dealing with, they pick up the phone and they reach out to their care coordinator over there.
Wonderful, thank you. That concludes the formal questions. So I'd like to thank you very, very much for taking the time to talk with me today and for sharing this information with our conference participants. Thanks, Deb.
Yeah, happy to do it. I'm always happy to talk about transition. It is my life and it's something I'm very passionate about. Thank you.
Thank you.